What is contrast dye used for in liver court scans? Imagine trying to see a city at night without any lights. Everything blends together, and it's hard to tell where the buildings or roads are. That's similar to what a liver looks like on a regular court scan. Contrast dye acts like a spotlight, helping doctors see the details clearly. It's a special substance, usually based on iodine, that is injected into a vein before the scan begins. Once inside the bloodstream, it travels through the blood vessels and into the liver tissue. Because the dye absorbs X-rays more than the surrounding tissues, it makes these areas appear brighter on the images. This brightness helps radiologists distinguish normal liver tissue from abnormal areas, like tumors, cysts, or other lesions. The main reason contrast dye is used in liver scans is to improve the accuracy of diagnosis. Many liver abnormalities are hard to detect without contrast because they look similar to healthy tissue on a regular scan. When contrast is used, it highlights differences in blood flow and tissue composition, making tumors or other issues stand out more clearly. For example, liver cancers like hepatocellular carcinoma or metastases from other cancers often have different blood supply patterns, which the contrast helps reveal. Timing is very important when using contrast dye. The scan is usually done in multiple phases, called arterial, portal venous, and delayed phases. Each phase shows different aspects of blood flow and tissue characteristics. The arterial phase highlights blood vessels and hypervascular tumors, while the portal venous phase shows the liver's overall blood supply. The delayed phase can reveal how lesions wash out or retain contrast over time. This detailed timing helps doctors better understand what they are seeing and make more accurate diagnoses. In addition to helping identify and characterize liver tumors, contrast-enhanced court scans are crucial for planning treatment. They help determine the size, number, and location of tumors, as well as whether blood vessels are involved. This information guides decisions about surgery, targeted therapies, or other treatments. Contrast scans are also used to monitor how well treatments are working and to check for any signs of cancer recurrence. While contrast dye significantly improves imaging, it's important to be aware of potential risks. Some people may have allergic reactions, which are usually mild but can be serious in rare cases. There's also a small risk of kidney problems, especially in people with pre-existing kidney disease or dehydration. That's why healthcare providers carefully evaluate each patient before administering contrast dye, considering their medical history and kidney function. In summary, contrast dye in liver court scans is a powerful tool that enhances the visibility of liver tissues and blood vessels. It helps doctors detect, diagnose, and manage liver conditions more accurately, especially liver cancer. Always remember to discuss any concerns or allergies with your healthcare provider before your scan. They can determine if contrast dye is appropriate for you and ensure the safest, most effective imaging possible.